Hi, welcome to another episode of Hair Talks. My name is Dr. Joshua Chong, and today we're going to do a 1-minute challenge on the benefits of using Finasteride. So Finasteride has been on the market for many years, ever since it was first introduced as Propecia back in the 90s. We know that it helps to reduce the rate of hair loss in men. You can start seeing stabilization of hair loss as early as 6 to 9 months after starting Finasteride or Propecia, while only 36% of men will see growth within the first 12 months. That number actually increases to 80% when you continue Finasteride for 18 months. Now, not only does it help with thinning hair around the typical balding areas in male pattern hair loss, it also protects the donor hairs, and we know that statistically, a man who's on Finasteride for 5 years will have 25% more donor hair than someone who does not take Finasteride. Additionally, Finasteride has been shown in some prostate cancer prevention trials to reduce the risk of prostate cancer, but that comes at a caveat that we will discuss after this 1-minute challenge, because 1 minute is up. Well, the prostate cancer prevention trials actually show that long-term Finasteride use actually reduces the risk of prostate cancer. It also shows that there is a relative increase in the rate of high-grade prostate cancers. Now, how that works is if the pool of prostate cancer patients is getting smaller, the relative amount of high-grade cancers are being diagnosed. That does not mean that taking Finasteride increases your risk of prostate cancer. It does actually mean that long-term Finasteride may predispose you to discovering prostate cancer later, and hence only discovering a more severe version of this prostate cancer. In summary, Finasteride protects your hair and reduces your risk of low-grade prostate cancers. It's something that we recommend very widely for our patients to use to get their crowning glory back.